Welcome to Health Connection with Kettering Health Network. I'm Chris Wilgues, and today we're talking to Dr. Katherine Clark, who is a primary care physician and part of the Integrated Medical Group, a member of the Kettering Physician Network. First of all, thank you.
Oh, thank you.
Patient-centered medical home is a term that's come up, at least to me, in the past couple of years, but I don't fully understand it. I'm afraid a lot of people don't. So maybe you can just kind of start me off with, what does that mean?
Yeah, a patient-centered medical home is a model or a term to refer to what we've really been doing for years and years and years in primary care, internal medicine, and primary care, family medicine, and pediatrics. And it's the continuous comprehensive care of patients and their families. And it's been more formalized in the past 5 years as a model for taking care of patients. And what that means is a medical home is not a house where you go to, but a medical home is where the core of your healthcare needs are provided. It's a place that you can go and you can feel as though you are at home, that you're respected and that you're educated and that your comprehensive care is considered, not just what you're there for one day or one visit, but for all of your care, including preventive care and acute care when you're sick, and ongoing care for chronic medical problems like diabetes and emphysema and asthma, congestive heart failure.
So basically, you may have a hospital stay here, you may have a specialist you've seen there, but all of that comes back and its home is with a doctor like you.
Yes, that's right.
Okay. What are the advantages for a patient that's being treated in this sort of atmosphere?
There's lots of advantages. I think one of the things that we look at that's really important is access. So one of the criteria to be a patient-centered medical home is that you need to have same-day access for your patients. So when a patient calls and they're ill, they need to be able to get in that same day. Or if it can hold off for one day, the next day. There needs to be after-hours access to at least advice for care, and that your physician needs to be able to have access to your chart, which would be an electronic medical record after hours, to be able to help guide your care. We would also be in touch with all the specialists and have ongoing relationships so that every time you would see a specialist if you'd need to, we'd be getting information back. And also any time that you'd go to the hospital or the emergency department, we'd be able to get information back, be able to see you back in the office, and be able to go over any care that you've had in other places so that we're sure nothing slips between the cracks.
So if you're part of a practice that uses the patient-centered medical home, and you're a patient that usually comes in, do they always see you, or is it okay, they're going to see a member of your team, or they're going to see somebody?
That's a really good question. So the patient-centered medical home, one of the important factors to be accredited is an accreditation program to become a patient-centered medical home. And one of it is that every patient has a doctor. So you have a doctor, and that you need to see your doctor most of the time. Now, doctors have to take vacations now and then, they get sick now and then, and so then there needs to be arrangements for coverage, usually within a group where there's several doctors or other providers like nurse practitioners or physician assistants can help with coverage. So if you're sick and your doctor is on vacation, then you would see somebody else within that practice, but they all keep the same chart, and your medical information is available to everyone. Also, a lot of patient-centered medical homes have what we would call a care coordinator, which would be a nurse or a medical assistant, who, if you're a well person and only needs to see a doctor once a year, you probably wouldn't have much contact with that person. But if you're a person with multiple chronic problems, like someone with heart disease or someone with uncontrolled diabetes, who is at high risk for having hospitalizations or having other serious medical problems or treatments, a care coordinator would work to be sure that all the complexities of your care is considered and would probably be in touch with the patient as well. Another really important part of patient-centered medical home is a commitment to quality and to looking at not only information about you, but information about all of our patients who might have the same kind of medical problem, so that everyone who would have diabetes in our practice, we would be trying to be sure that we were doing the very best we could for everyone to help get their diabetes under control. And also to have either procedures like testing or education, like diabetes education, be able to happen within the practice, as opposed to your care being scattered and having to go from one office for one type of treatment and another office for another type of treatment. So it's really we really want our patients to be involved and leading in their own care, and to be able to teach them to be able to manage their own care.
If you have more questions for Dr. Clark, you can find her at ketteringphysiciannetwork.org. There are more episodes of Health Connection on the way, so keep tuned for those. Also subscribe to the audio version on iTunes. And thanks again, Dr. Clark, for joining us.
Oh, thank you so much.